It is 6 p.m. and your baby wants to eat again and again and again, and you're exhausted, confused, wondering, is this normal? How can I keep feeding this baby? What is wrong? Let me tell you, cluster feeding happens, and it happens during any growth spurt or any sign of stress, and this is normal. This video is going to tell us about what is normal with cluster feeding, how we can accomplish it, how we can get through it, and the support you need to make it successful. Hi, I'm Jen. I'm a nurse practitioner, IBCLC, and mom of 3. And today we're going to talk about cluster feeding and what is normal and what is not, and when to be concerned, because cluster feeding can be exhausting and confusing and draining of every sense, emotionally, physically, mentally, sleep deprivation, and all that comes with it. So buckle in, we're going to get to it. Okay, so when does cluster feeding actually happen, and when do we need to be alarmed? Cluster feeding usually happens the first few days of your milk transitioning because your baby has a taste of that milk and wants more. That's your baby's ability to boost your supply. We don't want to stop and give a pacifier or a bottle when a nursing session is doing its job by increasing your supply and getting your baby a full belly. So keep that in mind the first few days after you come home from the hospital. Your baby's going to want to eat a lot, and that's okay. Now, it can also happen in weeks 1 to 2 and 7 to 10 days when your baby has a big growth spurt because they're trying to get back to their birth weight. Once your milk is coming in, they want to make up that lost time and get those calories in. It can also happen between 2 and 3 weeks, another period of growth and development. It also happens between 4 and 6 weeks. That's usually when the peak of the fussiness happens. That's when we can usually see colic ramping up because they're fussier, they're overtired, they want their moms, they want to be skin to skin, and nursing is part of that. We also see a big growth spurt at 3 months. So gear up for that sleep deprivation at that point too. And that's usually when we start seeing that 4-month sleep regression because they're growing and developing at an alarming pace. So stick in there and be patient. You're going to have a clingy baby, fussy baby, and all they want is their mom. So how do we get through it? Okay, how do we get through a cluster feed frenzy? These are some tips that I have. 1, get comfortable. Know that this is temporary, so only a few days usually while your milk increases or your baby figures out a new routine and figures out how to sleep better through the night. That's ideal. So get comfortable, get a snack, get your water nearby, have some support, have meals brought to you, hand and foot, like have your partner be there to just wait on you when you know that that's going to be a period, usually in the evenings before bedtime. Also, having to rest when your baby rests, knowing that you might need a nap before that cluster period starts is a good idea. Sleep helps your milk production as well. So I know it's cliche to say rest when the baby rests, but it helps. And there's a reason people say that. So don't be alarmed and don't feel like you're taking advantage of help when you're needing to sleep. Do it. You're running a marathon by making that milk and taking care of your baby. So do what you've got to do to be your best self for your baby to be the best of themselves. Also, don't rush to supplement unless you need to because weight gain is an issue or your doctor recommends it. Supplement only when needed, but try to keep that baby on the breast so that the baby can do the job of getting that milk supply to increase on their own. They are very smart creatures and they're very intuitive. They know what they're doing, even though it's really taxing on us as moms. Okay, so when do we worry about cluster feeding? When is there a red flag? When do we need to seek help? There are several things that will cause us to seek help through a pediatrician, lactation consultant, or our OB. One thing would be your baby just is inconsolable. Every time you lay your baby down, they cry, they fuss, they're acting hungry even though you just fed them. If that's happening around the clock, you need to seek help to make sure your baby's gaining weight, maybe do a weighted feed with lactation consultant and see if there's anything wrong that needs to be addressed before we just assume that it's more cluster feeding going on and on and on. Also, if your baby is not having at least 5 wet and poopy diapers in the first month, we need to seek help to make sure your baby's getting enough. Also, if you have any pain with breastfeeding, you need to seek help from your OB or lactation consultant to address the issue. There shouldn't be any pain during cluster feeding, maybe a little nipple tenderness because your baby's on there all the time, but there shouldn't be any breast pain or damaged tissue because of it. So for those reasons, If you need help, seek it. There's help out there. As a nurse practitioner and an IBCLC, I see it all the time, and I'm so grateful when I see those patients because they address the need and they're seeking help, and I know how to do it. So take care of yourself, and hopefully you can get some sleep, and I'll see you next time.